Services Committee meeting to order. Is she here?
Jess, are you on?
No.
Okay. Let's get to Bob at DSS. Bob Gibson?
Yep, I'm on.
Okay. We have your agenda pulled up. All you have is monthly reports.
Yeah, I decided I'd go light this month, so I have no requests. I'm just going to be on the line in case anybody has any questions, if I can help any one of the department heads.
Does anybody have any questions for Bob?
I see Jess joined us, Rob.
We'll do her next, all right?
Yeah, let me go back. She has
Hey guys,
another-
I'm here.
Okay.
All right. Any questions for Bob? All right. Thank you, Bob.
Thank you.
Jessica?
Yep, I'm here.
Can you see the screen? Hey, you're up.
I can. Yep, I can. I just want authorization for the Youth Bureau to accept the funding from the New York State Office of Children and Family Services. We haven't received the add-on yet. Do you want me on camera? Does it matter? It doesn't matter to me, whatever you guys think.
You're fine.
Okay, 52,797. And like I said, we don't have any add-ons yet.
I'll move that.
Second?
Morel.
Second?
Second. Yuri.
Second, Gary, all in favor?
Aye.
Aye.
Aye. Opposed? So carried.
Thank you. And I just wanted to take a couple of minutes just to explain. We have had three municipalities, I'm sorry. Well, no, Hillsdale hasn't chimed in yet, and I know they have a new supervisor, but Copake, Ankrum, and I think Hillsdale is going to be in on it too. Their money is going to go to the library out there because they didn't run any summer municipal programs. So I haven't heard from any other municipalities as to where they would like their allocation to be reallocated to. I'm hoping that they can just choose from any of the other agencies that we provide funding to. If they request, information on those programs, because there are programs running now.
Jessica, I'm not so sure the other supervisors, including myself, were even aware of that they needed to do that. And I'm sure that's why you haven't heard from them. Can you put something together to get back out to everybody?
I actually sent an email on, if you can just give me one quick second. I sent an email to all of the municipal supervisors. And I can give you the date of that.
Yeah, but again, I would still send it out again.
Yeah, that's fine. I can do that.
But I'm sure with all the emails going around, it was probably just overlooked. I would bet that's happened in a lot of the
Yeah,
towns.
it was sent on Tuesday, November 3rd to all municipalities.
Hey, Rob.
So I will go
Yeah.
ahead and send that again as a follow-up. That's
That'd
fine.
be great, Jessica. Thank you, Robert.
I don't think every town is signed up for this program. I definitely did not get an email on November 3rd from Jessica. Could I
No,
get a copy of that, please?
you have not received funding in the last 2 years, or when we discussed this a couple years ago at a committee meeting, you wondered why you did not have funding, and it was because the last supervisor did not apply for funding. They waived their funding, and so it was allocated elsewhere. And I had informed you, and I think I sent you, and I can look back in the file, but I had sent you an application last year for 2019 funding, and it was not applied for again, but I would be more than happy to send you the information for 2021 if indeed we have allocations again and funding again.
Yeah, well, this is a different time, and I don't want to take anything off the table, permanently. So I would appreciate being included in the email and seeing another copy of the application when it becomes available.
Yeah, that won't be until 2021 because the application process is over for 2020, obviously.
Okay, thank you.
You're welcome. Thank you.
Any other questions for Jessica?
Yeah, Jessica, this is Michael Schmiedis from Hudson. Are you connecting to Nick about this? Because I don't remember seeing an email. I know that Nick has been talking about this $8,000. Is that what this is about?
I have, and I've reached out to him several times because can I just close my door? Is that okay? Can you just give me 1 second?
Yep.
Okay, thank you. I have reached out to Nick at the youth center several times. I have the emails. The last I spoke with him was earlier or later in October, earlier this month also, giving him a deadline. I also reached out to the mayor, letting him know that Nick had not applied for funding. Usually he applies for the swim program at Oakdale, and because that did not run, he wasn't going to apply. And I did inform him that he could apply for any other program that he wanted to, even if it was at the youth center off season, like off summer season.
Mm-hmm.
He explained to me that he didn't really see it to be necessary to apply because the reimbursement when it comes to the city goes into the general fund and does not go back into the youth department fund.
Wow.
So he did not apply for the funding, and I did give him a deadline. And if I could get the file, I could let you know that. I gave him a deadline. I want to say it was the first week in November. But I can have copies of that. And I can also, if you would like, I never know what to do when it comes to the city of Hudson because there are 5 supervisors. Would you all like to be included and CC'd on those emails?
I would.
Yeah, I would.
I'm also curious how much money that would have been for the city.
$8,366.
Yeah, Sarah Sterling.
And is that deadline passed, or is that? I mean, I know you said that was earlier, but if we got it in like right now, would it be okay?
I think I could work that out. Yeah, because the city of Hudson did run a summer program. And if they didn't want to apply for any funding that they might have run, like from say September on when everything was starting to open up again. But it doesn't have to be for a summer program. They can apply for any program. If it's a tutoring program or something at the youth center, they could do that as well.
Okay, I'll circle back with them and make sure that gets into you. Thanks for letting us know.
Okay.
Jess, I have a question for you.
Sure.
Is there anybody that you can speak to that's over him if you're having, problems with him like this? Like not just wanting to participate because he doesn't think he needs to, or it's not beneficial.
Well, I had
You know what I mean?
Yeah, I had a call in. I did call the treasurer too because I was inquiring as to I didn't understand how the city budgeting went, and that it went into the general fund instead of exactly like being reimbursed to the city youth department. But it seems to me that in the past, it's always been done like that as well. Into the general fund is where the reimbursement comes from other directors that I've known down there. That's how it's always been. And nobody ever really wants to give up that funding. And to be honest, the city of Hudson gets quite a bit more funding for their summer program than other municipalities.
Yeah.
Well, I would think anything would help in terms of revenue for the city,
Correct.
just like it would help for a town. It would go into a town's general fund as well. I mean, that's general, that's like municipal accounting. It would be up to the city to transfer it at some point or to allocate the money up front and then offset it as revenue on the revenue side.
Correct. Yeah, I agree with that. And like I said, I do have, the emails and documentation of phone calls that I've made and just encouraging him to get the application completed, even though it was done. It was due back in before COVID-19 hit. I mean, it was due back in the end of January or February.
Oh, I remember that, yes.
Yeah.
If he
Jessica,
doesn't want it, I'll put dibs on it.
Jessica, this is Linda Mussman. I'd like to see the emails that said that he didn't want that funding because it went into the general fund, if you don't mind.
I don't know if those are emails. That was probably phone conversations.
Well, that would help. If you just put that in an email to me, I'd like to have that. Thank you.
Okay, thank you.
Yeah, it's tough. Yeah.
I would think for future, Jess, that your emails should, even though it may apply to only a few towns, it should probably be CC to all supervisors in case they decide to create a youth bureau in their, or a youth program in their town or something. Or since supervisors can change almost every, 2 years, maybe like in Rob Bury's situation, maybe they want to start it back up and it might have been a prior supervisor's decision. I don't think, would it hurt to just like CC all supervisors on that?
No, and I could do that. I've had issues in the past with, when there's a changeover with supervisors, a lot of times I'll have supervisors that call me and say, I have no file or no folder for Youth Bureau paperwork, can you help me out with this? And that's fine with me. There's many times that I have to make copies of their application to get back to them because they haven't kept them. But yeah, I can definitely do that in the future. And I'll be sure to just, include every supervisor in the county on my messages, whether or not they receive, funding or not. There were a lot of times that some of the smaller municipalities, I remember in the past, Livingston or Claremont would always sign off on their allocation to go to Livingston because their youth used to attend, that. And I know Supervisor Morrell, Chairman Morrell knows that, he has put his funding towards Greenport now. And because he doesn't have a recreation program. So, it all works out in the end if everybody knows. So yes, I can do that. And I agree with that. Thank you.
Thanks for all you do, Jess.
Thank you.
Thanks, Jess.
Any other questions? Thank you, Jessica.
Thank you. Is it okay if I log off now to get onto my other webinar?
Yes.
Bye-bye.
Okay, thank you. Have a good evening. Thanks.
Kevin,
Yes, I'm here.
you're up.
I'm by phone, so I don't have any. Like I said, I have two resolutions. One of them is to request authorization to renew annual contracts with the attached list of providers as they're due to expire at the end of this year. And that includes Family Advocates, which provide our legal services, the Healthcare Consortium, which which provides our seniors with medical transportation, and to our standard contracts that we do every year.
I'll move it.
Second,
Kathy Eldridge.
Supervisor Eldridge, second, all in favor?
Aye.
Aye.
Opposed? So carried.
Okay, thank you. And my second resolution is to transfer funds from the Connections for Caregiver account in the amount of $11,000 and send it to the following accounts: postage for $1,000, janitorial supplies for $3,000, and nutritional supplies for $3,000. It's already been sent to the controller.
Motion,
I'll move that, Morel.
second,
You're in.
all in favor?
Aye.
Aye.
Aye. Opposed? Carried.
Okay, that's all I have. I just did want to make an announcement. We had recently opened two of our senior centers, and with the spike in COVID, we decided to close them back down until things get better. So right now, none of our nutritional sites are open, as has been since last March anyway. So, but we just thought it'd be safer to not open and just wait till this thing gets a little bit better.
Well, that's unfortunate. How long were they open?
Livingston, we opened Livingston back in August. And, you know, I know the people down there were starting to get a little bit leery about what was going on. So we figured, you know, most of them people we put on Meals on Wheels for you know, until we reopen again. And then the other site we had was Stuyvesant, and they had been open maybe only about a month. And actually not people that have gone to our program, but apparently 2 parishioners out there were infected with COVID. So, and they had been in the building, so we just thought it would be safer to just close up, you know, until it's safe to reopen.
And what about Hudson?
Hudson, we put on hold. We never opened. We're actually supposed to open sometime this month, and we're going to put that on hold also. I know a lot of the people miss it, but we just felt with the way the numbers are going right now, it would be safer to stay closed.
Where's
And
Mark?
again, the people who really need, you know, they've been advised to work with our kitchen, and we'll put them on hot meals if we have to. So, you know, they shouldn't go without. The only thing they're gonna miss out on is a socialization. So, but we're always trying to come up with different programs to try to get people involved. So,
Any other questions for Kevin? Thank you, Kevin.
thank you.
Who's up next?
You got the health department.
Jack?
So I have a single resolution. We have a car, a 94, that is referred to as the Mustard Mobile because that's the color of it. Really nasty, ugly color that nobody wanted it back in the day when we first got it. It's our engineer who puts a lot of miles on because of all the inspections he does out in the county. The thing is really pretty much turned to junk. It's up in the parking lot. It's not starting. It was one of the cars that was egged apparently over the weekend. So we want to move it to surplus.
I'll move that, Morel.
Second?
I'll second it, Patsy.
Leader? All in favor? Aye.
Aye.
Opposed? So carried.
And my environmental report, I will certainly, I'll just point out, since it's on the screen, 28 new individual septic applications received in addition to a 12-unit subdivision in Claremont. We haven't received a subdivision request in a lot of years, but 28 individual septic applications. This continues the trend that has been going on the last couple of months. People are trying to get the heck out of New York City and coming up here, and they're building houses. And this is it's been a real bonanza when it comes to those septic applications this late into the fall. So I expect that would pick up again in the spring. I don't know if there's anything else other in here that anybody else notes. As of today, we have 12 positives. As Kevin mentioned, the spike is very real. The difference now between the spike that we have now versus the one back in April and May was driven by nursing homes. We early on in this second go around, we did have assisted living, which has resulted in something like 60 people between staff and residents. We also had 7 deaths there, sad to say. But now it's community spread, and it's all over the county. So I think that the second wave, the surge or whatever, is here very much with us. And per diem, our numbers equal to what Albany's going through. It's just here to stay. It's now that we're back in cold weather. Today we had our clinic. There was some of you were on before. So we had our clinic at John L. We limited to 100 test kits by Wadsworth. That's the deep swab. We went through those in the first hour, and we had people lined up around the block, right down on Columbia Street. I haven't seen that before. Fortunately, we had decided, we just received, about a week and a half ago, we received our antigen kits, test kits from the state. This is a nasal swab, but it takes 15 minutes to half an hour to develop the results, so it's a lot quicker. So we wanted to test it out. We were going to bring 25 or 30. Liz brought 60, and we used every one of them. So I think that there's a definite increased demand for testing. It's good we've got the antigen kits. These were we have two kinds. We have the kind that the swab gets put on the card and the reagent gets added to it, and the card is closed, and that's the easiest one to handle. We have another one that goes into a machine. We have 3 machines to process them. That's incredibly slow. It will not work at a clinic, and it's really more suited for a doctor's office. You can do the test. It turns around in 13 minutes, but it's incredibly slow. And I don't know, unfortunately for us, we have 3,000 of these combined kits. 1,000 of them are the card kits and 2,000 of them are the machine kits. They're going to be very difficult to use, but we still have them.
Jack, can you talk about what's going on in the schools?
Actually, schools are fairly quiet for us compared to other areas. We've had some pop-ups. We have a teacher at Taconic Hills. We have a bus driver at Taconic Hills. Today, Hudson announced 2 students, thankfully, that were already on remote. And so it is kind of creeping in, but we haven't had any shutdowns yet.
New Lebanon, Jack, is shut down.
New Lebanon shut down finally,
Germantown closed down its high school this morning.
I heard New Lebanon was contemplating it, and it's just I think a lot of it is mandatory quarantines. I know talking to Neil Howard at Taconic Hills, his problem is that when he has a positive, it puts a lot of his staff out, and he doesn't have substitute staff.
Well, that's what we have down here. So I guess I should ask, are the schools keeping in touch with you?
Yes. And
Okay.
we have a school specialist who was a retired school nurse who came out of retirement to take the job. The state is paying for her to do this job for us. She's great. And the schools keep regular touch with her, as well as my CD nurses who are doing a lot, doing contact tracing with them. So, we get notified of the positives through eClear. So we know about the positives. First thing that they do is check the age, because we want to get to that as soon as possible if it's a student. We check out to see if that student's a part of a school district. We talk to our school specialist. She talks to the district talks back with us. So we're pretty much regular communication.
Okay.
Robert, New Lebanon was a transportation individual, so it closed down their transportation, which obviously that's what closed the school down.
Yeah, in this case, it was a student, and they actually quarantined 5 teachers.
Yeah, that's what a lot of the schools are seeing. And
That's a big hit for a small district. So-
I just want to point one thing out, and Jack, correct me if I give any misinformation here, but when you see these numbers in the hospitals, I think it's important to note that because a lot of the individuals that were in nursing homes cannot go back to nursing homes unless they test negatively. And what's happening is these individuals go to the hospital, they have finished up their 14 days of quarantine, they're not in ICU, and they're ready to go back to the nursing home, but they can't go back because they still test positive. So they will continue to test positive for COVID, but their virus inside of them will be dead. So, but they can't go back to the nursing home. So we do have this group of people that you're going to see, you may see large numbers in hospitals. Some of them are these individuals that just have no place to go. So I think it's important to note when you see large numbers in the hospital that it could be quite a few of them. I know, I'm not sure when that was, Jack, but there were 26 of them this week at some point. I don't know what that is today, but so that's somewhat problematic when you look at the hospitals. And so.
Hey, Rob, I brought that up today at the Capital Region Control Room.
Yeah.
And there are other counties are going through the same issue. Rensselaer County, that they've noticed that with the senior population that it takes a lot longer for the virus to get out of their system, even though they're fine and they're well. So it is, a lot of the numbers of hospitalizations are up because of that reason. But they are going to look into it. I asked them to research it and see.
Yeah, we spoke trying to figure that out. The governor's talked about having COVID nursing homes where these individuals would go to a COVID-specific nursing home, but that hasn't happened as of yet. So problematic for sure. Just wanted to point that out.
Yep.
Thank you, Rob.
Anything else, Jack?
No, nothing else. I answered.
Questions for Jack?
I will say our committee that does the clinic met just before this meeting. We're contemplating a drive-through test clinic at AB Shaw, which is our site where we're going to do our vaccinations in the spring when that comes. We want to do a drive-through to see how that works out there and challenge ourselves as far as the number of lanes we're doing and whatever. And in response to requests from supervisors from the southern part of the county and the eastern part of the county, we're going to be looking for a location to do test in those areas, test clinics in those areas, and hopefully get it organized for December.
I want to thank Jack for his help with Greenport. We had a COVID positive employee, and there was a group of us that were out on quarantine. I myself was out for 14 days, and we had to close down a whole department. And he was very helpful. It was the morning after election, as a matter of fact, when I had to call, and I've never used my supervisor card, but at 1 minute after 8, when I knew I had a municipality that could collapse any minute, Jack got on the phone, and his nurses were excellent, his staff was excellent, and when you're involved in something that you never ever thought you would have to go through, and it's kind of like you learn every day as you go. You learn more about what you need to do. I think all in all, Jack, thank you.
You're welcome. And we're learning every day, and it's a new situation every day.
And I'm sure you are. I'm sure you are. But thank you. We very much appreciate everything, and your staff was wonderful with all of us.
Thank you.
Yeah, I want to second that, Jack. I've been hearing you on the radio. Sound good. Nice information coming out on the local station. I appreciate it.
Yeah, well, I did that for a lot of years. I was on the other end of the mic at one point in time.
I know. Comes in handy.
I know how frustrating it is to be one of those people that answers everything yes and no. I've had a few guests like that when I was a host, so I can talk up a storm.
Well, it makes a difference, and it's a big help.
Yeah.
And all the information that's come out, so many people have talked about, that I have spoken to, about the downsizing of their holidays, and people that have just totally canceled people coming over, and how they're going to keep it small. And it's a big thing. It's a big thing.
Anything else for Jack? Thanks again, Jack, to you and your staff. We appreciate it.
Thank you.
Okay. That leaves you, Dan.
Thank you, Rob.
Thank you.
Going, excuse me. So good afternoon, everybody. We have a pretty robust agenda in front of us, but I'm more than happy to take you all through it. So the very first item that you're looking at has to do with vendors that we have, contracted with historically. The first grouping is all state aid that is just being passed through to these various providers. The second grouping there in the middle is county contribution to those providers, to tax dollars. And then the third grouping at the bottom, and I'd be happy to go back to any of these and answer questions accordingly. The third grouping at the bottom is what we refer to as federal salary share dollars that we have budgeted for, that we then use to pay for services with these various providers. And I will mention, as people are maybe looking at this and going over this, I want to draw your attention to the middle category, and you'll see Twin County Recovery Services in there for a little over $118,000. I just want to point out that there has been a substantial savings there. There's been a reduction in terms of the amount of county contribution to Twin Counties to the tune of a little over $100,000. So that has gone down significantly. So I felt it was important to point that out.
Hey, Dan. Dan, these numbers are the same. Well, they're in the budget for 2021 now.
Yes.
Okay, so these are the same contracts that we typically do year to year?
Yes, yes, this is, let me just,
They're in the budget. Yes, they are. I've adjusted them.
thanks,
After
Rob.
Joe, se-
Appreciate it.
after Joe sent me the resolution, they've been
Okay.
adjusted accordingly.
Okay, I'll make the motion to approve this.
Okay, thank you. Appreciate it.
Second,
Sterling.
all in favor?
Aye.
Aye.
Opposed? So carried. I also want to just mention that Dan has done a great job in reference to looking through these numbers, seeing if there's any cost savings, and digging down. He and I have spoken many times about this, so I appreciate that, Dan.
Thank you. Thank you for saying that, Chairman. I do appreciate that. And if there is time, I did ask for some time to talk about a few things on the agenda. It's in the comments category, I believe, or we can talk about that. So let's see. This particular resolution has to do, and this is not a new one. This is for our lead medical consultant, Dr. Carlos Valier, and he has exceeded the agreed upon amount of revenue that his salary is contingent upon him generating the minimum of $123,000. I just want to let people know that he has historically exceeded that number. He's extremely efficient and productive, and a great asset to us here at the Columbia County Department of Human Services. So I ask that this resolution be supported.
I'll move it. Morel.
Second,
Sterling.
Sterling, all in favor?
Aye.
Aye.
So carried.
Thank you. Let's see. This is a similar resolution for another one of our prescribers. It's specifically through Columbia Memorial Health, the hospital, but they provide Dr. Abdel Hamid to us for 6 hours. And again, Dr. Abdel Hamid is very productive, very astute in terms of seeing our clients and providing services to them. So this is a very good use of the monies.
Do I have a motion?
I'll move it, Burien.
Second?
Second.
I'm not sure who that was.
Abdus.
It was Patsy.
Second?
Oh.
I'm sorry, we have a second and a first. All in favor?
Aye.
Aye. Opposed? So carried.
Thank you. Let's see. Okay. So keeping in tune with prescribers, this resolution has to do with a contracted psychiatric nurse practitioner for 21 hours a week for a period of 6 months.
I'll move that, Patsy.
Second?
Sterling, second.
All in favor?
Aye.
Aye. Opposed? Carried.
This resolution has to do with the Department of Human Services, specifically the Columbia County Mental Health Center, providing behavioral health services to the student body at Columbia Green Community College. As you know, we've had to pause that temporarily because of our staffing issues. I have been in conversations with Chairman Lagonia and with President Drummer about what our plans will be to resume that and provide those behavioral health services to the students at Columbia Green Community College. I have a phone call later this week with President Drummer. My hope is that I will be in a position to provide a staff person for the college as early as the spring semester. So we would like to have this resolution and contract in place.
I'll move it. Morel.
Second?
Sterling.
Sterling, second. All in favor?
Aye.
Aye. Opposed? Carried.
Thank you. This is for consultation services, primarily to assist us in our CFR creation, just general financial consultation through CCSI. This has been in effect for previous years, so we would just like a continuation on it. Joe Ambrose is the one who typically taps into this. He's told me that historically, we don't even use the $4,500, but we'd like to have that available to us should we need it.
Motion?
Sterling.
Second?
Fury, second.
Fury, all in favor?
Aye.
Aye.
Carried.
This resolution has to do with the, excuse me, the Columbia Green Addiction Coalition. This was a coalition that goes back many years, maybe almost 10 years now, that was created to fight the opioid epidemic. It's still a very robust coalition, very, very effective in terms of, fighting the opioid epidemic that is still, unfortunately, alive and well in our community. There's some website development, and this is the website development. We're looking at splitting the cost because this is a coalition that we have with Greene County as well. So we want to split the cost for the website development with Greene County. Our share is up to $2,300.
I have a question. Dan, do we have any figures on even this and also suicide rates? Have they gone up a lot? We're just not getting any figures at all because COVID's taking all the press.
Yeah, and thanks for asking, Supervisor Sterling. So to give you exact figures, I would have to get back to you. Anecdotally speaking, from what I've read, what I've heard from colleagues, and what I've seen, as the clinic director here and now as acting department head for the Department of Human Services, I can say unequivocally that it is still very much alive and well. Unfortunately, the rates of suicide throughout the state have gone up. If you'd like specific data, I could certainly provide that to you. With the opioid overdoses, that has also gone up. It's the opioid overdoses as well as the suicides are tricky to label, though, because we have to remember that not all overdoses or suicides are documented. The suicides, it's difficult to really truly determine, was it a suicide, was it an accident in some cases. So there's a deviation there. Same thing with the opioid overdoses, but generally speaking, yes, unfortunately, both are going up.
Thank you.
Yeah.
So I have a question, Dan. What is this for? Is this to pay somebody to do something, or is this
Right. Yeah. So and I apologize for not being able to say more than this, Supervisor Musman, because my involvement in this was quite robust early on in my tenure when I was the dual recovery coordinator. When I became clinic director, I kind of phased myself out of this coalition, and Michael Cole took lead. He actually, I believe, co-chaired it. So now that I'm back in it, what's happening is, the coalition believes it's important to have a very, well-developed and defined website so that they can get their messaging and their information and updates out to the public so that awareness can be spread through social media, such as a website. I'm not sure if they're using Facebook. They may or may not be, but so this web developer is the expert when it comes to this. And the coalition felt that rather than, limping along with maybe members of the coalition that have some knowledge about how to create a web page and things like that, they really wanted to go to the expert and get a polished product. So that's why they felt this was important.
For less than $200 a month for the county share, that's not a lot of money for a webmaster. Could you send us a copy of the link? Because I'm just interested in taking a look at what they do.
Yeah, absolutely.
Don't need it now. Don't need it now. But
no, I'll send it to Kelly and she'll push it out if that's okay.
That's
my question was, I thought there was a website. Is this for a new website, or that's all?
This is the website, Supervisor. It's the one that we had voted on probably a year to 2 years ago.
Right, that's what I thought.
But every year we have to
renew
the agreement, I guess, or subscription.
Yeah. It's the ongoing development to maintain it, to keep it relevant, to keep it updated.
And the link is on our Columbia County main website. If you scroll down, Unfortunately, some of the stuff gets put down as all the COVID stuff is filling in the top of the website. But there is
Yeah.
the link to this website as well as the opioid website. On the bottom of, if you go to ColumbiaCountyNY.com, you'll find the link there.
Thank you, Kelly.
Thanks, Kelly.
Has anybody made a motion on this?
No, not yet.
I'll move it.
Second,
Second, Sterling.
Supervisor Sterling, all in favor?
Aye.
Aye.
Opposed? So carried.
Okay, so this has to do with Chatham Central School District. This is not to be mistaken with the behavioral health satellites that we provided to all 6 of the school districts at one time. What we had done specifically with Chatham was that we created, and they requested this, and we were more than happy to oblige, is that we created a specific menu, so to speak, an a la carte sort of menu of clinical and behavioral health services that were not necessarily of a reimbursable sort. And we assigned a dollar value to those services, of course. And, that would allow Chatham to say, we need your worker to participate in an assembly, or we need some specific sort of psychological testing to be done. They could simply reimburse us at an hourly rate based on the identified rate within this agreement. I felt it was important to continue this. I have not communicated directly with Chatham about whether or not they want to, have this ongoing, but I just assumed that it would be best to have this continued for 2021. Should they approach us and say, hey, we have a need, this agreement would still be relevant and in play. So this doesn't cost us anything. In fact, it would generate revenue.
I'll move this, Patsy.
Thank you.
Second,
Eldridge.
all in favor?
Aye.
Aye.
Opposed? Carried.
Okay, so we have historically relied upon the Bonadio Group for consultation regarding internal mock audits, HIPAA compliance, risk assessment, things like that. So this resolution speaks to that. It is, as you may understand, it's in our best interest to have this sort of protection so that we don't take as significant a hit should we be audited at some point in the future. This is money well spent, in my opinion, as far as relying on Bonadeo, which is very experienced in doing these types of audits and advising us accordingly. So I ask for your support on this resolution.
It also helps with our corporate compliance.
Okay, this is budgeted.
Yes,
Yeah.
it is.
Yeah, I'll move it.
Second,
Second.
Abdus, all in favor?
Aye.
Aye.
Opposed? Carried.
So this resolution has to do with Upper Hudson Planned Parenthood. They are participating in a New York State Office of Mental Health initiative that allows them to provide a very minimal level of behavioral health services. And when it goes beyond a certain level, the idea is to transition that person to someone like ourselves, let's say, the next level of behavioral health services beyond themselves. One of the requirements is for them to have a nurse practitioner oversee in a corporate compliance sort of way the documentation, also provide supervision to the clinicians who participate and provide the actual service. So we have contracted with them. I believe last year was the first year of that. And that initiative is going along very well. It's building a nice relationship between us and Upper Hudson Planned Parenthood. We cultivate a few referrals out of the relationship. So it's a win-win in that regard. the other part to it is they also have one of the individuals that provides the behavioral health services is a licensed master's level social worker who is interested in obtaining her C. That's the next level of certification for a social worker. And in order to do that, she needs supervision. So they are willing to pay us to provide that supervision.
I'll make the motion.
I'll second it.
All in favor?
Aye.
Aye.
Opposed? Carried.
And this final resolution, I believe it's the final resolution, is just presenting members that have expressed their interest in joining the Alcohol and Substance Abuse Subcommittee, Lori Torgensen and Vanessa Vogel.
I'll make the motion.
Second.
Just out of curiosity, Dan, Lori Torgensen's from Greene County?
I don't. I assume the point you're making is that, is she eligible and can she participate in a Columbia-based substance abuse subcommittee?
Yes.
Don't know the answer to that. I assume that the chairperson of the committees, I can certainly ask them to validate the concern or verify the concern. I know Lori does a substantial amount of work in her role here in Columbia and Greene County. But I'll bring that up. I can bring that to the attention of the chairpersons.
Yeah, I mean, I have no issue with Lori. I know her, but I know she was from Greene County. That was my only.
Yeah, good point, Chairman. Okay, so let me just bring that up. I did not know where she resided and such. So maybe it'll be an issue. Maybe it's not. I don't know.
So
I don't either. So.
Do we want to hold off on this then as a result?
Yeah,
of
why don't we hold off?
Oh, no.
Okay. All right.
We'll pull it. Is that going to create any issues, Dan, or we still have time to do that?
I think we have time. And I know there's an emergency meeting in December. I don't know if we would want to use that time for something like this, but
can we appoint Vanessa Vogel at this point and just pull Lori Torgensen, or we can't do that?
I don't know. Does anybody know?
Mr. Chairman, we could do a special meeting before our board meeting in December if we had to.
Okay, then let's just pull the whole resolution.
All right. I'll send out an email before I leave work tonight and see if I can get an answer. And who should I reply to? Chairman Lagonia?
Yeah, that's fine. I'll let Chairman Morrell know.
Okay, thank you. So I do have a few items that I'd like. Oh, overtime report. Yes. So you'll see we've used a minimum, slightly less than $1,000 worth of overtime out of our $15,000 budget. So we're well below our budgeted amount for overtime.
Okay, you had a couple of other things, Dan?
Yeah, thank you, Chairman Lagonia. If I may, I'd like to bring two things to the committee's attention. So one of them has to do with, I want to make you all aware that Ichabod Crane Central School District has approached me. They have a new superintendent who seems to be very much a champion of having behavioral health services in the Ichabod Crane School District. And so I had some preliminary conversations with, not exactly sure of his title, but I believe he's an assistant to the superintendent, Lucas Christensen. He's formerly from the Chatham School District and worked very closely with their superintendent. So now he's kind of moved over to Ichabod.
He's the assistant.
Is he? Okay, yeah, thank you. So what we've talked about is how this would look, because everybody I'm sure is aware that we were taking a bit of a hit financially on the school satellites. So prior to me coming on board, Michael Cole had communicated to all of the districts that we would need to be made whole, meaning for a 7-hour day, which roughly equates to $800 for the 7-hour day, we would need the school districts to pitch in the $400, 50% of that. And in talking with Ichabod, they are agreeable to that. However, we both have to do a little work, because what they wanted to do is they wanted to utilize the COSER funding. And I don't know if any of the supervisors remember Michael Cole having explained that, but that is funding that is available to the districts. But what the districts have to do is they have to front the money, and then they get reimbursed on the back end. So in the following academic year, they would be reimbursed for those monies. Now, I was under the understanding that that COSER funding was very much still in play and available to the districts, and that's what I told Mr. Christensen. He wasn't so sure, so we had a conflict there. So I've since reached out to Gladys Cruz to verify whether the COSER monies are or are not available, because what I'm being told by Ichabod is the only way they could swing it in terms of the $400, the 50% making us whole, is if they could tap into that. So I just wanted to bring this to your attention, because I think it's a positive thing. You know, we certainly have a willingness to put ourselves in a district who's willing to meet us halfway. You know, we're not willing to go to a district and participate in providing behavioral health services in the way that we were historically, where we were losing money because of the limitations around the types of services that we could provide, and the schools wanting us to perform all sorts of other services which were not revenue generating services for us. So if we can work something out in which the Ichabod Crane Central School District is willing to meet us halfway, as had been previously proposed, I would certainly like to figure out a way to do it. Because as you can imagine, the pandemic, along with all the other things, the substance use issues and everything else that's going on in our community, is still very much in play and needs to be addressed. So, you know, I verified that. I said, how is the student body doing? And unequivocally, I was told by Lucas that the kids are struggling. They're having a hard time. So I would gladly entertain questions, comments about this, you know, announcement or information that I'm sharing with you. Do I have your support to continue to work on this with Ichabod Crane School District is ultimately what I'm asking.
You know, I think this is where we were headed when we were still, you know, able to meet in person. We wanted to find out what the school districts were willing to do. Again, it bears repeating, this has nothing to do with Special Letter 504. Those children who are identified as requiring services get those services regardless of cost or how it's financed. School districts are on the hook for that. This behavioral service is important. It's not mandated, which is the difference. Which is, I'm interested in the COSER also, and see if they're willing to use COSER funding to pay for something like this. So I would say go ahead and do the investigation, you know, and figure out if we can make something like that work, because everybody's right. This is very, very tough times on the kids, you know, in the schools, and we should try and figure out a way to make it work if we can.
Yeah, I agree.
Okay. Any questions related to this? Because I have just one more thing I'd like to discuss with the committee.
Hey, Dan, are these services billable, by the way, that we're providing?
Yes, absolutely. You may remember, Ron, so under our New York State Office of Mental Health license, we're restricted to providing certain types of services that we can then get reimbursed for. Things like psychotherapy sessions for a duration of 30 minutes or 45 minutes. But often what would happen is the school, you know, the school's needs were beyond that. And they wanted our worker, who was at that time on site, to participate in those types of things. The other problem was, you know, it's not as easy as, hey, the kid is in school, they're a captive audience. Let me take them out of a class and get them down to my office to conduct a therapy session. Because we had competing forces with the districts in terms of the core curriculum that they were trying to provide that student. So it wasn't always easy to get the child to the therapist's office at the school. So, you know, those were some of the reasons that we were struggling financially.
And it has to go against the parents, I imagine, health insurance, not the kids or the school. It has to be the parents
Right.
cover. Yeah.
That's correct. So there was an element of that. If they had a third party insurance, which at the moment we don't regularly accept, there's a process for that where it comes to me as the clinic director, and I make a determination as to whether I'm going to do an override and so on and so forth. But correct, we would depending on the district, there would be varying compositions of students that had Medicaid and Medicare, which is what we readily accept, versus an abundance of third-party insurances that we don't readily accept.
Right. Okay. So I thought.
Yep.
Hey, Dan, I lost my connection on my computer because I probably in that computer savvy and I won't update my system here.
It's okay.
Yeah. Listen, with Ichabod, I'd be glad to help you. Pat Grattan and I started that way back when, to get them in there. We really had to push our way through, and Michael Cole was there that too. But I think that if you approach it the proper way, and we can do it, and don't worry about the money, they got the money. I just paid my school taxes this year, and I know they got lots of money.
Well, I appreciate the support. I appreciate the support, and it seems like we've turned a corner with that particular district, I have to say, because they approached us.
Well, I kept pushing it. And then COVID hit, and I was on a lot of meetings with them, and we were hoping we can continue it.
Well, I'm glad, and thank you for doing that. I wasn't aware of that. I thought it was spontaneous on their part, and I'd like to believe that it was.
Well, yeah, now they can do it, and
maybe with
I
your
told them to get out of the box and think about the kids and not the money. So,
well, thank you.
That's my issue.
Yeah, I'm hopeful, especially if COSER funding is in play, and something I didn't mention, which I should, is that Lucas, and I believe he's speaking for the superintendent, would like to adopt the a la carte contract that we just approved that existed in Chatham. He would like me to construct a resolution of that sort. So that may be coming your way with regard to Ichabod, let's say in January.
That'd be good.
Approval, because he really appreciated having that as an option when he was at Chatham for the students there. So I told him it's just a matter of me formulating a very similar resolution and presenting it to all of you, and then so on and so forth. So he understands the process, but they're interested in that as well at Ichabod.
That's good to hear.
Okay, thank you. So if I may, I'd like to move into the next and final item that I'd like to discuss with you. And this is, again, to bring to your awareness and also to get some guidance. We have a bit of a situation, and I want to speak in generalities in terms of the privacy of the individuals involved, but we have a nurse practitioner who unfortunately has a pretty serious medical condition. And as a result of that, she's going to be out for a extended period of time. She's also made me aware that once she returns, she would only like to work 2 days a week. And what she's going to do is subsidize the remaining 3 days with her accruals, which are quite robust. And once that's done, she will likely retire. I say likely because that's not definite just yet. But what this means for us, and this is one of our employed nurse practitioners, and she is incredibly productive. She's a rock star, to put it bluntly. Really, really loved by the clients that she sees, and incredibly efficient and productive. But if she's only going to be with us 2 days a week, then basically 60% of her time has to go to someone. So fortunately, I have at the moment a student nurse practitioner, psychiatric nurse practitioner intern, who is graduating in December. Now, you all may remember, I do have a budgeted position for a psychiatric nurse practitioner, which is not filled at the moment. So what I would like to do in preparation for all of this that's going on with this employee that is ill is that I would like guidance on, at what point I can present a resolution to fill the vacant budgeted nurse practitioner position. Because the other thing is this student is going to be graduating in December. She's eager to find employment, whether it's with us or some other employer. And I can guarantee you she will be snatched up quite quickly by other, providers. So what I was thinking, and maybe this has to go to the committee where these sorts of things are discussed, the personnel requests.
Yeah, I'm sure it's going to have to do that, Dan. Matt, is those positions, I know we had mentioned about budgeted positions, is that a position that was still left open, or?
Well, I'm going to defer to Ron. Ron, are you still on?
I saw Ron left.
Ron just left.
Okay, I do believe that we had $1.7 million worth of vacant positions that we swept for next year's budget. So we're going to have to take a look at that.
Yeah.
And that was how we got to where we are and how we're trying to avoid furloughs and layoffs.
And I imagine, so this is the first I'm hearing of it, and I understand that. Hopefully what you took was, there was because I don't want to confuse the two, there was a title that we created called, I believe it was Senior Psychiatric Nurse Practitioner. That was an approved title as well, which was never filled. This position that I'm talking about is a standard psychiatric nurse practitioner position that previously belonged to an employee named Colleen Morgan. And, we
please don't use names.
Oh, I'm sorry.
We're gonna have to go into executive session if,
Okay, I'm sorry.
yeah.
So I guess I'll wait to hear, and you'll let me know as to whether it's still an option.
Yeah, we're gonna have to take a look at that.
Okay, but I think you understand the situation that I'm facing if this particular employee, reverts to 2 days a week. There's a tremendous amount of her caseload that will need to be assigned, and right now I don't have anywhere to assign it.
Dan, let's find out for sure if that position was swept or not. As Matt said, he's not sure. Let's find out from Ron.
You bet.
Take that up with the budget.
What's the salary range, Dan?
I believe Joe is with me. Joe, are you with me still? If you can chime in on that, because I don't want to screw that up.
Hi, everyone. Yeah, it's around 100,000 a year.
Okay. All right. Thanks.
Dan, would that, again, if that's the amount, 100, is that the amount that would be offered to a student just graduating, or is that number somewhat, negotiable? I'll use the term negotiable. It's not really what I mean, but
I think it's a civil service title, so it's going to be,
yes,
it's going to be that salary range. I mean, she'll probably take 15% less, but because of the union.
Okay. Well, let's do that, Dan. So before you have a problem, okay?
You bet. Thank you. I appreciate the support. I apologize for my faux pas. I hope it was harmless.
It's hard when you
my
get into
apologies.
positions because sometimes you have to go in executive session. I just wanted to
Okay.
catch you before the wrong
Thank
things
you.
got said.
Are there any other questions for Dan? Dan, do you have anything else?
No, thank you, everybody, for your
I really
time.
appreciate how comprehensive you are and everything that you're bringing to this committee. It's very, very helpful. Thank you.
Okay, appreciate that, Chairman Ligonia.
So Dan, just before you jump off, the position is nurse practitioner?
Yes, and Joe can correct me if I get this wrong. It's psychiatric nurse practitioner.
Yes,
Okay.
grade 28C, I believe.
All right. Thank you.
The position that to be honest with you, if we had to abort is titled Senior Psychiatric Nurse Practitioner. That's the one that we had approved but never filled. We were looking to create a mechanism, a step mechanism for nurse practitioners that have been with us and who have brought in their experience and taken on new duties so that they could get a bit of a bump. But that never came to fruition. it would be unfortunate if that went away, but I completely understand, given the financial situation and the greater scheme of things.
Just so
Okay,
you know, Ron Caponero lost his internet connection. That's how, Chairman, when you were trying to reach out to Ron, he got cut off, so.
okay.
Very good.
I'll give him a call.
Anything else for Dan?
Yep. Okay. Good
Thank you.
evening. Bye-bye.
Anything else the committee wanted to bring up or discuss?
I do, Kathy Eldridge. This is for Mr. Commissioner Gibson. Do you have a site set up yet for the Edith Casey Stocking Fund? I have a car full of toys that was donated to me today.
Oh, what a great question. I do. We're going to do it in my back conference room here.
Back conference room. Okay.
Yep. So
You'll be
anytime
seeing
you
me
want to
this week.
arrange.
You'll see me this week.
Oh, I really appreciate that. You'll see the boxes, folks, out and about and out in front of Finger Insurance and whatnot. We're moving forward. We're going to end up doing deliveries this year and not have a storefront. But you know, we want to be able to deliver as we usually do.
Okay, yeah, because oh my gosh, if these had come before the Abate toy run, it would have been perfect, but we just got them today, which doesn't make a difference. It's a wonderful, wonderful, nice big donation. And number two, I want to know, you know, getting back to Jessica when she was talking about Nick, what was going on, you know, who's going to be going after Nick about this? It really doesn't seem to be like it's a county problem, but more a city youth committee chairperson or the commissioner of the youth department.
Kathy, I'm going to ask some questions. There's a meeting I'm going to go to tonight discussing the budget, so I'll bring it up.
Okay, perfect. Yeah, you don't want to let this go. You don't.
Michael Chimidas was on earlier and he's the mayor's aide, so I'll remind him also, or Linda can.
Okay.
Yeah, I mean, I already said earlier in the meeting that I would talk to Nick. I'm not sure if the language of going after Nick is the right term, but I'll talk to him. He said he would reach out to Jessica. There was a miscommunication, and so we'll work it out.
Who's going to speak to Nick? Who's going after Nick to speak to him? That's my language. It's all the same language. It's all the same, Michael. It's all good.
All right, is there anything else?
Just a reminder that there's a 5:30 solar meeting if for all supervisors that want to attend.
Okay.
Kelly, will there be, could you please ask for a copy of the presentation for supervisors that cannot attend?
It's recorded. Every meeting is recorded because they're all public.
Okay,
So it'll
thank
be on
you.
the website tomorrow.
Thank
Oswaldo will post it.
Thank you.
Everybody have a wonderful holiday.
One more thing.
I'll entertain.
Chairman Odonia? It's Dan Almasi. Can I just chime in with one more thing?
Sure.
Sorry. So, Kelly, if you would mind, on the vendor resolution request form, I should have mentioned we need to make an edit where it says Northeast Career Planning. It should be Unity House / Northeast Career Planning.
Okay.
They merged.
Okay.
And then,
Dan, just send me an email and I can get that corrected for you.
Okay, and in terms of the numbers for the nurse practitioner positions, I have those. So the psychiatric nurse practitioner, just the straight employee, was 88,000, and they're not subject to the steps. The senior psychiatric nurse practitioner was the 96,000.
Okay.
All right, I just wanted to get that to you.
Great.
All right, thank you. Sorry for the interruption.
Nope.
No worries. Motion to adjourn?
Motion.
Second?
Sterling.
Right here, Kathy
All in
Eldridge.
favor?
Aye.
Aye.
Thank you, everybody.
Hey, Rob,
Yes.
Ladonia, I just
Yes.
got off the phone with Ron. We're going to look at it tomorrow, see if we can make a necessary adjustment. so
Okay.
that- And then bring it back to the committee.
Great. Thank you very much.
All right?
Take care, everybody.
Yeah,
Good night.
Rob, you're doing a great job too, you know.
Thank you, Kathy. I appreciate that.
I know you do. I know you do. Bye, everybody. Have a great